Dr. Jee is a special representative for health diplomacy of the Korea Foundation. He's a visiting professor at the Graduate School of Public Administration at Seoul National University. Previously, she served as Director General of the Center for Infectious Disease Research at the Korea CDC. And I think very relevant to our conversation today, she was a member of the WHO International Health Regulation Emergency Committee on COVID-19 and of the WHO Scientific Advisory Group for the Blueprint on Research and Development Preparedness for Epidemics. And we're very happy to have her today. Youngmee, thank you for coming on. I know it's late in the evening there, so I'll turn it over to you. Thank you.
Thank you, John. Good morning, good afternoon, and good evening, colleagues. I'm Youngmee Jee, the Commission of Korea Disease Control and Prevention Agency. I will just try to. So can you see my slide?
Yes. Go ahead, please.
Okay, so first of all, I want to thank Dr. John Ward and Coalition for Global Hepatitis Elimination for inviting me to this very important webinar. And to achieve WHO's goal of eliminating viral hepatitis by 2030, many member states introduced national hepatitis elimination program that provide necessary support for screening, diagnosis, and treatment. However, disruption caused by COVID-19 could have unintentionally forced countries to scale down the viral hepatitis elimination program and delay the implementation, and thereby hindering progress towards reaching the WHO's goal of viral hepatitis elimination. And so now is the time for all member states to make concerted efforts to achieve the goal of eliminating viral hepatitis by 2030, recognizing hepatitis as one of the most critical global public health challenges while preparing for future epidemics and pandemics. So Korea has established the National Pandemic Preparedness and Response Plan in May this year, under the vision of building a safe society free from infectious diseases with agile and collaborative crisis management and resilient emergency response. And I do believe this plan to prepare for future pandemics can somehow also benefit our efforts to control viral hepatitis. And now I'm quite happy to mention that Korea has also established its first national strategic plan for viral hepatitis B and C control in March this year to achieve the goal of eliminating viral hepatitis by 2030 in line with WHO's hepatitis elimination goal. The 5-year plan includes upscaling the whole cycle for viral hepatitis cases from prevention through diagnosis and treatment. And we have been committed to make various efforts to control hepatitis B during the last 3 decades. And we have implemented the National Immunization Program for all infants in 1995, and perinatal HPV prevention program to prevent mother-to-infant transmission has been put in place since 2002, enabling infants born to mothers infected with hepatitis B to receive hepatitis B vaccination and immunoglobulin. And they were also eligible for free HPV antigen and antibody testing. And as a result, in 2008, Korea became the first country in the Western Pacific region to be certified by WHO for achieving the regional goal of hepatitis B control. And thanks to these endeavors, the prevalence rate of hepatitis B has decreased to 2.7% in 2021, from around 7% back during the 1980s. And notably, we observed a significant improvement in reducing the prevalence rate of hepatitis B among children aged 10 to 18, dropping from 4% in the 1980s to 0.0% in 2021. So building on this momentum, we will continue to promote perinatal HPV prevention program and expand the program's eligibility to include multicultural families and foreigners. Furthermore, to achieve the goal of eliminating viral hepatitis by 2030, we have incorporated diverse programs for hepatitis C control into the first national strategic plan for viral hepatitis control. With this plan, we will ensure early detection of hepatitis C cases and promote linking diagnosed cases with optimal care and treatment. While Korea provides a national health screening program for all citizens, the program currently does not cover testing for hepatitis C. Therefore, we now want to include test screening for hepatitis C for a certain period and establish a follow-up system to improve the linking to optimal treatment for individuals with confirmed viral hepatitis through this screening program. And we have also initiated a pilot program targeting the treatment of high-risk groups of hepatitis C, including IV drug users and inmates of correctional institutions. As the world is recovering from COVID-19, it's crucial that the national capabilities and resources directed towards COVID-19 response and strategically share the strengthen the efforts to eliminate viral hepatitis and to prepare for emerging infectious diseases while considering the unique context of each country. And these efforts are especially important in the WHO Western Pacific region with relatively high morbidity and mortality related to viral hepatitis B and C. The strengthening governance and collaboration at the national and global levels would be crucial in achieving viral hepatitis elimination goal, and Korea stands ready to collaborate with all member states and share our experience, lessons learned, and relevant policies. We will also closely work with WHO and other international organizations and agencies, particularly the Coalition for Global Hepatitis Elimination or Task Force for Global Health. I do hope all member states will join the forces in fostering the global cooperation and collaborative framework for pandemic preparedness and elimination of hepatitis. Thank you.
Thank you very much, Youngmee. Excellent overview. And it's really exciting to see the progress in the Republic of Korea with the development of their new strategic plan and a really remarkable contributions that lay the foundation for further progress toward elimination of hepatitis B and hepatitis C in the country. Thank you so much for sharing that with us. And I look forward to working with you on building this global support for hepatitis elimination.